Welcome to Brightview's 5 Minutes That Matter. Today, we're going to tackle some of the most persistent myths around addiction and recovery.
And our goal is pretty simple, really.
Yeah, it's to cut through the noise and smash the stigma that keeps so many people from getting help.
So if we're going to talk stigma, we have to start with the biggest one. The idea that addiction is a moral failing.
Right, that a substance use disorder is just a bad choice, a character flaw.
And that one idea, it probably causes more damage than any other.
It's just so pervasive. But the research is incredibly clear on this. It separates moral failure from chronic illness.
It does.
The bottom line is, developing an addiction isn't a choice. It's a chronic brain disease.
The analogy I always come back to is something like high blood pressure or diabetes.
Exactly. You don't choose to get high blood pressure, right? Even if maybe your diet contributed to the risk.
And it's the same thing here. A person does not choose to develop an SUD. The disease itself is completely separate from their moral character.
So if we accept that it's a disease, then it obviously needs a medical response.
It does. And that brings us right to one of the biggest treatment controversies.
MAT.
Medication-assisted treatment, or MAT.
And this is where you hear that really dangerous myth that MAT is just swapping one drug for another.
Or that willpower alone should be enough.
So why is the medical community so certain that MAT is the way to go?
Because trying to quit cold turkey is, frankly, not just ineffective for most, it can be extremely dangerous. The body goes into shock.
So MAT provides stability.
It provides crucial stability. Medications like, say, Suboxone or methadone, they're designed to safely occupy the brain's opioid receptors.
So just to be clear, they aren't providing a high, they're more like a safe placeholder.
That's a perfect way to put it. By occupying those receptors, they stop that awful cycle of withdrawal and the really intense brain-driven craving.
It levels the playing field.
It does. It gives a person the stability they need to actually engage in therapy and the real work of long-term recovery.
Okay, so moving past that initial treatment phase, we have to talk about the recovery path itself, because it's not always a straight line, is it?
Not at all.
And that leads to the next myth, that relapse is a sign of total failure.
And this is where that chronic disease model is so essential. Think about it this way. If someone with asthma has an attack, we don't say they failed.
No, you'd adjust their treatment, their inhaler maybe?
Exactly. Relapse is disappointing, of course, but it just means the care plan needs to be adjusted.
So progress is more important than perfection.
That is the core message. Progress, not perfection.
And while we're on the topic of saving lives, let's talk about harm reduction. There's so much skepticism there.
Oh, yeah. The idea that giving out Narcan or running needle exchanges just enables people.
Right. What's the reality?
The reality is that harm reduction is about dignity and saving lives, period. Yes, it reduces overdose deaths. It reduces the spread of infections like HIV and hepatitis C.
Yeah.
But there's another piece to it.
What's that?
It's a bridge. The data shows that most syringe services programs have a really high success rate of referring people directly to treatment centers.
Wow. So they're often the first point of contact for someone who feels too ashamed to just walk into a clinic.
They're a gateway to help, not away from it. They connect people to care.
So let's bring all this together for you, listening at home. What does it all mean?
Well, first, addiction doesn't discriminate. You can have a great career, a supportive family, and still develop an SUD.
And you don't have to wait for things to get terrible. You don't need to hit rock bottom.
Absolutely not. Getting help the moment you see a problem is vital.
The knowledge is clear. Recovery is always, always possible. The framework for all of this should be simple. We treat you like a person.
And we treat addiction like a disease.
That's it.
And that combination, medical reality and just deep human respect. That's the most powerful tool we have.